Hello, my name is Will Carpenter. Today we'll be conducting the 100-point physical exam. My patient will be Aaron Hubbard. The equipment that you'll need to do to conduct this exam will be your blood pressure cuff, hand sanitizer, gloves, pulse oximetry, a pen light, a deep tendon reflex hammer, a tuning fork for testing the Rene and Weber test, a safety pin for testing sensory deficits for sharp and soft, thermometer, which I may have already mentioned, tongue depressor, gloves, stethoscope, and a watch with a second hand. At this point, I'd be coming in to meet my patient. I'd have my hands washed. I would come in, put fresh clean gloves on, introduce myself. Hello, my name is Will. I'm one of the nurses here. What brings you here? What is your name?
My name is Aaron Hubbard.
Okay, and your date of birth?
It's August 8th, 1983.
Okay, are you allergic to any medications?
Tylenol,
Okay, and do you know what city we're in right now?
San Francisco.
Okay, great. And do you know what month it is or year?
April 2016.
Great. So at this point, I've assessed that the patient is alert, oriented, following commands, he's well dressed. So at this point, I would begin my assessment and I would ask for the patient, okay, Aaron, I'll have you sit down. Come around on this side. At this point, I would get the patient's vital signs, which would be his height, his weight. I would palpate his systolic blood pressure, as well as palpating a pulse. I would count his respiratory rate. I would auscultate a blood pressure. I would check pulse oximetry. I'd assess his pain level. I would document all these vital signs and treat accordingly, obviously. And then at this point, I would begin the physical assessment. I'm going to start with the head. So I'm going to be inspecting his scalp, making sure that his hair is evenly distributed. He's got no patches that are missing. He's got no swelling, no lumps, no depressions, no lesions, no wounds, no drainage, no redness, no bugs, anything like that. Once I've assessed a scalp, I'm going to assess the frontal and maxillary sinuses for any pressure, soreness for sinusitis. Is any of this sore?
No.
Okay, great. Once I've assessed that, I'm going to assess his lymph nodes. So I'm assessing his occiput back here for his occipital lymph nodes. I'm looking for his post-auricular lymph nodes, his tonsillary lymph nodes, submandibular, submental, anterior cervical, posterior cervical, and subclavicular lymph nodes. At this point, I would move ahead. I would go to his eyes. So I'm checking the skin around his eyes, making sure that it looks normal, that there's no redness, no swelling, no drainage, that there is no dryness of the eyes. I could check his conjunctiva as well. And from here, I'm going to check the responsiveness of his pupils. Are his pupils equal, round, reactive to light, and accommodation? So what I'm going to do is shine a light in his left eye and make sure that his pupil responds, as well as the pupil in the right eye at the same time. They're both reactive. And then do that to the right eye, which they both are. I'm going to check his accommodation, so I'll have him look at my finger here and then look off to the distance to make sure that his eyes are adjusting. Once I've done that, I'm going to assess his extraocular movements. That would be cranial nerve number 3, ocular motor, 4 trochanter, and 6 abducens. So I'll have you look at my finger, move over here, up, down, over here, this point I've noticed he has no deficits, so I'm going to move on to the confrontation, which is checking his peripheral visual acuity. So I'm going to put my fingers out here and wiggle them and ask him which fingers he sees moving and to point to them while looking straight at me, directly at me. Okay? Okay. At this point I've assessed his pupils, so I'm going to move to his ears. His eyes. I'm going to move to his ears. I'm assessing his ears. I'm inspecting and palpating that there's no drainage, no redness, no swelling, that he's not having any pain. I'm going to use my tuning fork to assess for any hearing deficits. I can also check his.
I hear that.
Okay. Now I'm going to do the Weber test. So when I do this test, I'm going to bring this, place it on the top of your head, and you tell me if you hear it in your left ear, your right ear, or in the middle. This is checking for any deficits in either ear.
I hear that in the center.
Okay, great. Now we're going to do the Rene test, where we check air movement, that the ear is able to pick up air movement as well as sound through the bone. So you tell me which one you think is louder when I hold it next to your ear or place it on the bone.
Next to my ear.
Which is what we would hope. At this point I'm going to move to inspection of his nose and palpating his nose, making sure there's no deviation, there's no swelling, no drainage, there's no dryness. I can ask him to smell something to check the olfactory nerve. What does that smell like?
It smells like rubbing alcohol.
It does. Making sure it is. At that point I've assessed the olfactory nerve, and I'm going to move on to his mouth. I'm going just looking at his mouth, making sure that it's dry, there's no drainage, he has no cracked lips, that the mucous membranes are moist. So when I assess his gag reflex, I can also assess his palate, his teeth, make sure there's no cracked teeth, no missing teeth. So I'll have you open your mouth and stick your tongue out and say ah.
Ah.
I've checked his gag reflex. I've checked his tongue, that it's laying flat, it's laying in the correct position. So far as everything is looking well. Now I need to assess his facial movements for symmetry to make sure that those cranial nerves are intact. So I'll have you wince your eyebrows and wiggle them around. Stick your tongue out, move it left to right. Now I'll have you blow your cheeks out while I press up against them. Now push your tongue against that. I've checked the strength of his tongue doing that, which is correct. And next I'm going to inspect his neck. So I'm looking at the skin around his neck and palpating his neck, making sure that there's no swelling, there's no redness, there's no tenderness. His trachea is midline, his thyroid. I'm checking for any masses, any swelling, that his airway is intact. And now I'm going to have you shrug your shoulders, please. Okay, great. So once I've assessed all that, I need to move on to the musculoskeletal system. For this, I'll have him actually stand up. And I want to check all your joints. So first I'll have you turn around so I can assess your spine for any kyphosis, which would be the hunching, lordosis, which would be the curving in of his spine with the pronounced buttocks, and scoliosis, which is the curving of the spine. I'll have you stand straight. Can you bend forward? I'll check the spine here. Now I can check the the movement of his back. Can you move kind of side to side and front and back? Does that all feel okay?
No problem.
And what about your neck moving around front and back? Okay.
No problem.
So now I'll have you turn around. And so I want to check the range of motion of his arm. So I'll have you move your arm and your shoulder. How's all that feel?
Great.
And I can take it here, move his elbow and his wrist. And you can clench on your fingers here really tight, as tight as you can. And then what about moving your fingers here? That feels good. while I have you here, I'll have you lift your leg up, move it around,
Mm-hmm.
and kick your knee out. Any pain with that?
Not at all.
And I'll have you sit down. Then I'll have you adjust your ankle, any pain,
No
toes,
pain.
any pain?
No.
So at this point, I'll have him actually walk so I can assess his gait to make sure that he's not tripping, that he's has no ataxia. Have him come sit back down. Before I do the straight leg raises, I'll check his deep tendon reflexes. So I'll sit here and I'll check the brachial radial. Make sure we have movement of the muscle. And then check his brachial. And looking for movement of the muscle there. And I'll have you relax the arm like this, check the tricep. Okay. Now we can check knee. So if you relax your knee here for me. Okay. And we'll check your ankle. Alright, and then at this point we also check for the Babinski's reflex by running along the outside and moving medial, making sure that his toes don't go out. And at this point then I'll have you lay down here on the bed. I'll move your hat. Now if you could raise one leg, keep it straight, and raise it straight up. We're going to check. Are you having any pain in your lower back or anything like that?
None.
Okay, great. Okay. So we got me sit at the edge of the bed. At this point, I've completed the neurological assessment. Oh, actually, I'm sorry, no, I haven't. I need you to stand up for me. Stand straight like this, straight ahead. Now close your eyes. Okay, that's good. At this, I'm assessing the Romberg's sign, and then I can have you. Okay, you open your eyes and sit down. And I need you to run your heel down your shin. Do that a couple times for me. Great. Okay, perfect, thank you. Now at this point I'm going to assess his lungs. You can stay seated there. I'm now going to check his chest, his front and his back, make sure that it's symmetrical. I'm going to make sure the diameter looks correct, and that I can palpate for fremitus. So what I'm going to have you do is I'm going to have you say 99.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
And we want to feel vibration, and if you feel an increase of vibration, we have suspicion for consolidation. And then at this point, I'm going to percuss his lungs here. Now I'm going to listen to his breath sounds in the 8 positions. So I'll have you take a big deep breath in and out. Alright, so since I've assessed the posterior aspects of the lung, I'm now going to auscultate the anterior aspects. So take some big deep breaths for me. Great. At this point, I need to do an assessment, a cardiac assessment. So I'll have you actually lay down, and I'm going to assess for any thrills, the PMI, point of maxillary impulse, as well as heaves. So for the point of maxillary impulse, the 5th intercostal space, subclavicular line, my palm here, feel for the pulse. Okay, you feel it there. Now I'm going to put my palm here, feel for any thrills. Take my 2 fingers and place them between the second intercostal space to feel for any heaves. Now at this point, I'm going to auscultate the aortic, pulmonic, the Erb's point, tricuspid valve, and the mitral valve. So now I'm going to assess the aortic, pulmonic, Erb's, tricuspid, and the mitral. At this point, I'm going to begin assessing as well his carotid arteries and listening for any bruits. So I'll do one at a time, feeling, listening, actually, sorry, I'll have you hold your breath when I'm listening, sorry. Okay, I'll tell you when to hold your breath. Okay, hold your breath for me. Very good, go ahead and breathe. Okay, now hold your breath. Alright, very good. At this point, I've assessed his cardiac function, so I'm going to assess his vascular system and making sure that his skin has good turgor, that there's good color, there's no bruises, there's no lacerations, there's no swelling. I would check his carotid pulse. I could check his brachial pulse, his radial pulse, his femoral pulse, popliteal pulse, the dorsalis pedis, and the posterior tibial pulse here, making sure they're all present. You can check cap refill of his fingers and toes, making sure it's less than 2 seconds. Once I've done that, I want to assess that he has no edema. He has no edema. So we'd say that he has 0 pitting edema. From here, I'm going to move on to my abdominal assessment. For his abdomen, I'm going to inspect the skin of his abdomen. I'm going to palpate, I'm going to inspect the umbilicus here, inspect the abdomen. What I'll have you do is I'll have you raise your head up and take some deep breaths so we can see if we have any bulging or swelling. So I'll have you kind of lift your head up a little bit. You don't have to lift your shit up if you want, that's fine, whatever. And then just take some big deep breaths in. We're looking for any bulging, any masses to rule out any hernias that might be there. At this point, I want to auscultate for bowel sounds in the right lower, right upper, left lower. I'm listening for bowel sounds. Lower, upper. Bowel sounds are present in all 4 quadrants. At this point, I want to move to auscultating his aorta, the splenic artery, renal, and femoral. At this point, I would percuss the areas, making sure that it's sounds present. I would check for Murphy's sign, which checks for any gallbladder tenderness by feeling below the last rib and kind of right where your liver would be. Are you having any pain right there?
No.
Okay. Now that's the Murphy's and Bernie's. We're gonna check for, it's halfway between the umbilicus and the iliac crest. We're checking for any appendicitis. Any pain there?
No.
this point, I can also test for rebound tenderness. We press in and let go. You have any pain when I let go? You have
Not
any
at
pain?
all.
And it doesn't radiate anywhere else when I do
No.
press in? Okay. At this point, I would, at this point, I think I've assessed everything abdominal wise. At this point, I would ask, well, actually, I guess I can ask, you technically don't need to be here, because at this point, I would assess the genitalia and the rectum. I would check the inguinal and femoral areas for any hernias. I would check inguinal lymph nodes. I would inspect the genitalia for any discharge, rashes, lesions, swelling. I would check the perineal area for any swelling, redness, discolorations. I could check his rectum for bleeding, discolorations, any pain. If my patient were a female, I could check breasts, if they're swollen, tender, anything like that. For male, I could check testicles for swelling, as well as checking prostate. And I could check, I think that's about it. At this point, I would thank my patient, ask if they have any questions, and review my assessment, make sure I hit everything, remove my gloves, and wash my hands.